Okay, can you guys hear my voice clearly?
Yes, okay.
Yeah. Sorry, Aziz?
Yes, we can hear you.
Really?
Okay. So sorry for the last minute changes. There has been a lot of meetings that we have to reschedule. So yeah, and I only managed to send the video series to the class representative this morning. So have you managed to watch them all?
Not all.
Not all. How many of them? I mean, ada masalah ke untuk watch that video, or you actually plan to watch it sometime later?
No, baru sampai, kalau saya baru sampai schizophrenic diagnosis. Tengah tengok apa tu.
Okay, how about the rest?
I'm the same with Samba. Schizophrenia diagnosis.
Okay, let's discuss about schizophrenia. So do you guys have any question after watching maybe part of the video series that I've given to you? Any question about schizophrenia?
I have a question about the term used, apathy, and also apathy is the term used to indicate less of interest. Is it the same as evolution from
Come again,
evolution?
I can't hear you.
Um,
Evolution.
apathy and evolution, is it the same thing or is it something different?
Okay, so the difference between apathy and evolution. Okay. Right, okay. Lagi? Any other question?
I have another question. Is it schizotypal disorder and delusional disorder will actually can further develop into schizophrenia or not?
Schizo what?
Schizotypal disorder and delusional disorder.
Delusional disorder. Okay, thank you. Number 3, any other question? Thank you, Aina. Thank you, Abdulaziz. Lagi? Samba, do you have a question? How psychotherapy is done? Right, psychotherapy and schizophrenia is something yang there is a role of psychotherapy in schizophrenia, but that is not the mainstay, not the mainstream therapy for schizophrenia. So thank you for asking, but maybe I letak benda tu dekat bawah sikit if we have more questions specific to schizophrenia. Any question about psychopathology, symptoms of schizophrenia, positive symptoms of schizophrenia, what's delusion, what's hallucination?
I have one question regarding the symptoms about disorganized. We have disorganized in action and speech, and we are particular about the speech. How about the action? Can you give some example of disorganized in action?
Okay, thank you. Shafika. Next.
Assalamualaikum.
Yeah. Assalamualaikum.
Actually, I have a question regarding when I read through the website that you have sent us. It says that the causes of psychotic disorder is, one of them is if one of the family members has a psychotic disorder, then that person is more likely to develop. I want to know how, in which way does it affect the person itself?
Okay, thank you.
Thank you.
Okay, we have 4 questions. Let me answer them. So Abdul Aziz asked about apathy and evolution. Basically, schizophrenia. We divided the symptoms of schizophrenia into several domains, right? We have positive symptoms, negative symptoms, cognitive symptoms, and I can remember there is another symptom, maybe mood symptoms, okay? So kalau we talk about positive symptoms of schizophrenia, we are actually talking about psychosis. And psychosis here means, simply if we say psychosis is, if someone asks you, what is the difference between psychosis and neurosis? Pernah dengar kan neurosis? Right? Pernah dengar tak? Neurosis pernah dengar?
Pernah dengar neurosis, cuma tak tahu benda.
Okay, nanti kita discuss. So psychosis comprise of hallucination as well as delusion. Okay, so hallucination and delusion. Negative symptoms, there are 5 symptoms, the 5 A's of negative symptoms. These 5 A's of negative symptoms are not similar to the 4 A's of Blauler. Pernah dengar kan 4 A's of Blauler? I don't know how to pronounce it. Blauler ke Blauler, but 4 A's of Blauler. So the 5 A's of negative symptoms. Yeah, Aziz tanya tadi tu, 5 A's of negative symptoms of schizophrenia as listed in the DSM-5. They are, apa dia Aziz? Anhedonia, evolution, asociality, asociality, affective blunting lagi,
Logia.
alogia, right? Okay. So when we talk about anhedonia, basically that is loss of interest, just like depression. And that's why a patient with negative symptoms of schizophrenia, sometimes we thought this is depression, but maybe lack of other symptoms of depression. And the effect of schizophrenia patient is affect their blunting, another negative symptoms of schizophrenia. So apart on top of anhedonia, we also have blunting of affect. Bila kita kata alogia, basically patient experience apa ni kita kata lack of mental activity. Okay, when you ask one question, the patient will take some time to respond to you, and the mind appear to be blank. Okay, there is nothing inside his mind, literally zero. Okay, so patient has nothing to say, nothing much to talk about. So that is alogia. Lagi satu, asociality, lack of social and also social initiatives to meet people and then to engage in social punya situation, and evolution. So evolution ni you can basically there is lack of motivation or initiative to do anything. Anhedonia more towards interest to do. You have interest, passion. But evolution, lack of initiative or lack of drive to do anything, whether it's pleasurable or non-pleasurable. So typically, if you ask a patient with schizophrenia, negative symptoms schizophrenia, you ask one question. Tell me, what do you do from morning sampai malam? What do you do from morning until night? So you can elicit 5 symptoms of schizophrenia, negative symptoms there. The patient, the verbal output is near zero, okay, ataupun very minimal amount. And patient say that there is a slowing of thoughts, so that is alogia. And patient tell you, from morning to night, I just stare at the ceiling. Okay, I didn't do anything, or maybe just bangun tidur and sleep, nothing else. So that is asociality, that is evolution. And how about taking food and then seeing your doing your previous hobby, no interest at all. So that is anhedonia. So just asking one question, you can actually elicit that 5 symptoms of schizophrenia. So what's the difference between apathy and evolution? Apathy is about feelings, yeah, right? Apathy is about the ability to appreciate other people's feelings and to be engaged in social situation. Okay, right. Aina's question is about schizotypal delusional disorder, whether these two develop into schizophrenia. Schizotypal, when we talk about schizotypal is actually a cluster A personality disorder. If kalau ada kelas dalam personality disorder, we have cluster A, cluster B, and cluster C. Cluster A personality disorder comprises of schizoid personality disorder, schizotypal personality disorder, paranoid personality disorder. Okay, that is cluster A. So basically, people in cluster A personality disorder, they are aloof, they are, we can say, typically they are atypical in the sense that they tend to spend time alone, and their focus of interest are on kalau macam schizotypal ni, the focus of interest is on something mystical. It's about, you know, paranormal, spiritual, or related to contohnya extraterrestrial punya beings. So there are many other features of schizotypal, and studies have shown that those who exhibit signs and symptoms of schizotypal, the risk associated with schizophrenia is higher. Logically, you fikir macam schizoid personality should actually have a higher risk, about schizoid and schizophrenia sound so close, and the symptoms is about paranoia. Tapi no evidence show that schizotypal is actually has a higher risk to be schizophrenia. In psychiatry, we don't actually say one thing caused the other. It's difficult to prove this causation in psychiatry. Let's say, can I say that taking cannabis causes schizophrenia? No, you can't, because there is no an empirical study that can show taking cannabis causes schizophrenia, because there are other people who are taking cannabis, they don't develop schizophrenia. And this is answering Ibrahim's question about how does a family member with schizophrenia or psychotic disorder affect family members with schizophrenia, with that particular disorder. So basically, how does the disease manifest? It is because of genetic, okay? As well as in other condition yang bukan schizophrenia, it is due to other factors. I will mention afterwards. In schizophrenia, it's purely genetic, but as I said earlier, nak prove that possession too is difficult. So we say in psychiatry it's polygenic inheritance. Okay, there is no one single gene in schizophrenia, but there are multiple genes involved in the manifestation of schizophrenia. Okay, polygenic inheritance. And it is not only gene, there is also Satan, isn't it? No, I'm just reminded. So polygenic interaction, genes, polygenes and environment. Okay, so orang ada gene yang banyak tadi tu, so berinteraksi dengan environmental factor. For instance, when you take substance combined with gene that you already have, your family has, so the disease manifests. But for those who doesn't have schizophrenia gene, taking cannabis may not manifest schizophrenia. So it's actually the interaction between genetic substance and the environmental factor, being stressor, early exposure to abuse, child abuse. You know, child abuse is one of important factor that cause a person to develop schizophrenia later on. Stress, early childhood adversity, substance, what else? Yeah, dysfunctional family. Okay, so it's actually the interplay of this factor that manifests schizophrenia symptoms. Shafika asked about disorganized action, how to differentiate, what are the example of disorganized? From the word itself, you know, we do things by, we organize things, kan? So, you know, in order to call someone, I pick up this phone and then look for the phone number and then I press that button and then I put it here. But just to show you how disorganized behavior is, maybe you take this one and then you put it into your mouth, or you just put it into your pants, you know, in an appropriate place. So there is lack of proper organization in your action. You take a cup of water and then you pour on the table, you pee on the floor instead of going to the toilet. But of course, you have to rule out urinary incontinence, you have to rule out delirium, you have to rule out dementia. When these things are ruled out and the behavior seems to be disorganized, right? So that is called disorganized behavior. Disorganized speech, the structure of the speech are disorganized and it affects comprehension and understanding. So those are the 4 questions. Can we have more questions coming?
Assalamualaikum, Doctor. I have a question about the schizoaffective disorder. It is said you need to have also mood disorder. So how to differentiate between like the depression with the schizophrenia? A bit confused.
So your question is about schizoaffective.
Affective disorder, yes.
Schizoaffective disorder. Okay, I'm looking at the chat now. How psychotherapy done? Does most of the schizo patient presented with both positive and negative symptoms of either one? Fatnin, Afika. Shakira's question about schizoaffective. Now, so you fulfill the criteria of schizophrenia, the criteria A of schizophrenia. Positive symptoms, psychosis, delusion, hallucination, negative symptoms, disorganized speech, disorganized behavior. Those are the 5 criteria A schizophrenia. Now, in schizoaffective, the psychotic part is prominent, but at the same time, patient also has prominent mood symptoms throughout the course of illness. Meaning to say, patient fulfill, I mean, not to say fulfill, but dia punya mood symptoms are prominent and present most of the day, on top of psychosis, on top of psychotic symptoms that the patient had. Okay, and if there is an absence of psychosis, if there is an absence of, is it psychosis or mood? You have to check back. If there is an absence of psychosis or mood symptoms, it shouldn't be more than 2 weeks. Okay. Right. Can someone share DSM schizoaffective punya criteria here? Shafika, you look through that and then we'll come back to this topic to clarify on that 2 weeks duration too. In the meantime, I'll try to answer other people's question. Does most of the schizophrenia patient presented with both positive and negative symptoms or either one? Initially, typically they present with positive symptoms, psychosis and hallucination, auditory hallucination and delusion. When the condition become chronic, the positive part of schizophrenia become, reducing intensity, and the negative symptoms started to emerge. So you can see that negative symptoms are more prominent in chronic schizophrenia. And during that time, patient yang chronic schizophrenia, they may have negative symptoms, banyak, positive symptoms mungkin sikit. But that doesn't matter. Banyak sikit tu still, you know, you can diagnose a person with schizophrenia. Is there any clinical significance to differentiate between bizarre and non-bizarre delusion? Yes and no. Last time in DSM-4, when we use DSM-4, it has a special weightage for bizarre delusion. So bizarre delusion signifies, so indicates that the person has more likelihood to have schizophrenia as compared to delusional disorder. So bizarre means something which is not comprehensible, cannot be understood based on our interpersonal experience. Can you give example? Bizarre delusion.
Bizarre tu, can I try, Doctor?
Yeah, sure.
Yang if I'm not mistaken, kalau yang for bizarre tu, dia is the belief, contohnya kalau dia percaya yang there is an outside force remove his organ and replace it with someone else. Contoh for bizarre. And then kalau non bizarre ni macam apa delusion yang dia dah under apa police custody, tapi dia percaya yang there is lack of convincing evidence macam tu.
Okay, right. So that's the example of non-bizarre, the later one.
Yes, dia macam tak pelik sangat compare dengan bizarre.
Right. Yeah, okay. So thank you, Hafiz. So non-bizarre, something yang can really happen outside there. Like I accuse my wife of having another affair with someone else. That's possible, isn't it, in real life? But I don't have evidence. You ask me the evidence, I don't know. I just say no. I strongly believe there is something on the bed, contohnya, or there is something in the bag, but I cannot truly prove that she has an affair with someone else. That's something yang can be done. That's something yang boleh anybody does it. But bizarre delusion macam yang Nafis sebutkan tadi tu, atau to make it more obvious, I myself, I believe I am a stone. I believe I'm a microscope, something like that, something that cannot be achieved. So a delusion which is cannot be understood by our daily experience. Okay, so that is so last time they differentiate. Schizophrenia should have bizarre delusion. No delusional disorders patutnya tak ada delusion, bizarre delusion. Okay. So talking about bizarre ni, saya tak jawab soalan si Aina tadi. Schizotypal and delusional disorder, do they develop into schizophrenia? Schizotypal tadi Adam jawab, okay, ada risk. But delusional disorder, if you look at the population, it's different. Schizophrenia usually develop during teenage years, okay? Awal, 11 tahun, 12 tahun, 15 tahun, right? But delusional disorder usually mid-age, di tengah-tengah, right? 30s, around 35, 40s. So it's a bit later. And there is lack of hallucination. Lack of hallucination in the diagnosis of delusional disorder. You may have hallucination, but it must be present in the context of delusion. Let's say I believe that you are doing harm, you are causing me harm through certain means, and I have hallucination related to that delusion. That's fine, and it should be minimal. Okay, the lack of hallucination in delusional disorder. Whereas in schizophrenia, you can hallucinate in with not related to your delusion. Okay, you can have hallucination yang tak ada kaitan dengan delusion tu. Okay. Shakira, have you checked the schizoaffective?
It says delusions or hallucinations for 2 weeks or more. It should not.
It should not what?
Yeah, for the B part, it says delusions or hallucination for 2 or more weeks in the absence of major mood episode, depressive or manic during the lifetime duration.
Okay, in the absence of mood, isn't it? Okay, so coming back to schizoaffective. So you must have psychosis, you must have prominent mood symptoms throughout the duration. But
that
in
means
case
we have the psychotic symptoms first?
No, sekali, right? Concurrently. So, and let's say the mood symptoms and suddenly disappear, okay? The psychosis should persist. Psychosis must persist throughout. Okay? Why this is important? Because you want to differentiate between major depressive disorder with psychosis. In major psychosis disorder, major depressive disorder with psychotic features, patient develop depressive symptoms, low mood, anhedonia, suicidal ideations and whatnot, plus with psychotic symptoms, usually mood congruent. Maksudnya, I feel sad, I feel suicidal, at the same time I'm hearing voices yang congruent to my mood, which is saying you should kill yourself. Okay, the voice tells me to kill myself. So we see that auditory hallucination is mood congruent. Once you treat the depression, or once the mood settle, psychosis tu pun akan hilang. So this is to differentiate dengan schizoaffective tadi, mood hilang tetapi psychosis still present.
Okay, faham. Thank you.
Okay. What is the intervention? Okay, dah pukul 11. What is the intervention can be done if the only criteria are not met in 6-month duration? In psychiatry, you have few class of medication. You have antipsychotic, antidepressant, anti-anxiety, you have benzodiazepine, you have mood stabilizer, 5 classes of medication. And we always, for schizophrenia, we have the regimen, we have the protocol, guidelines. You can refer to CPG, Malaysian CPG for schizophrenia, Malaysian CPG for bipolar, Malaysian CPG for depression. So in order for you to, kalau someone present to you with psychosis, regardless of diagnosis, you treat with antipsychotic. Regardless diagnosis, regardless duration. Patient is psychotic, treat the psychosis. If there is an underlying cause to that, like substance, treat substance. If it is because of meningoencephalopathy, treat meningoencephalopathy. If it's because thyrotoxicosis with psychosis, treat thyrotoxicosis. Plus with antipsychotic. Contohnya macam patient with meningoencephalitis, they are giving IV antibiotic, but psychosis is still there, takes some time to recover, you can give antipsychotic as a temporary measure. Okay. Dr. Nizam dah ready ke?
Dah.
Dr. Nizam dah masuk?
Dah. That's okay.
Belum.
Take your time.
Right. Okay. Okay. Kalau ada soalan lagi, or if you guys think we need more class, more time for this, then we can find some time for this. Okay. And sorry again for the last minute changes. I don't want to take Dr. Nizam punya masa. Orang ni orang sibuk ni. Okay, Nizam.
Tak apa. Okay. Right je. Budak-budak ni yang present pun.
Ya. Okay, ada soalan yang kena jawab hari ni juga. Kalau tak jawab nanti tak boleh tidur.
Dia tidur ambil benzo.
Doktor,
Yeah, Aiman.
I have one question lah, out of context lah sikit. Question is, we as Muslim, kita kena percaya pada yang kejadian macam jin dan syaitan kan. And for this case, like, are we totally reject the belief in jin and shaitan possession when it comes to psychiatrist's point of view of hallucination, delusion in schizo patient?
Okay. Nizam jawab, Nizam. Soalan ni soalan famous. Right. So our stand on this, whether we reject.
Dia tanya tempat yang betul dah tu. Saya deal dengan makhluk halus, tapi makhluk halus yang child lah, child and adolescent punya halus. Halus-halus yang tak nampak ni Dr. Nabil.
Yang botak, yang hijau, yang pendek tu ada?
Jarang datang klinik.
Okay. So with regards to your question on our take on apa ni, spiritual ataupun paranormal punya influence, sama ada jin dan syaitan ni ada influence kepada in causing hallucination or not. So soalan yang sentiasa akan ada, dan there will be no conclusion to this because people differ lah. So if my take on this is, if you want to see that hallucination is caused by jin and Satan, so we have to bring evidence from our own tradition lah. So meaning from Quran, Hadith, and the opinions of our scholars. So from our tradition, among scholars pun ada perbezaan pendapat tentang benda ni. So some scholars, or majority of scholars, believe that when we talk about possession ni maksudnya satu kuasa luar, an external force come and control you, so that you become you cannot control yourself. Okay, so you do things beyond your control, so that is possession and hallucination and delusion. So they discuss among themselves. Some of them give evidence towards the possession. Okay, maksudnya setan can possess. Okay, the other disagree with that and they give their own evidence. There is an article for that. I'll share you both opinion. Okay, I'll share that with your class representative and maybe you can have a look. But my take, I need to say that whether or not you have mental illness, schizophrenia, non-schizophrenia, depression, normal people, every one of us as a Muslim, we believe we are influenced by both parties. We are influenced by angels, we are influenced by Satan, we are influenced by our own nafs, our own self. Okay. So to say that psychosis or hallucination is caused by Satan, it has several implications. Implication dari segi stigma. Patient don't want to seek help from psychiatrists because they attributed this to something else. So apa dia punya implication? They seek treatment late. What happened to their brain? Their brain experience more and more toxic environment, and dia punya severity to become worse. Okay, because of delay in seeking treatment. So that is one implication. And second, stigma tadi itulah, right? Okay, so people tend to blame iman and something like that because they develop psychosis. So these are the implications that we need to take into consideration before we want to give our opinions on this matter. If I can say, in the Quran, the most quoted verses which is used as an evidence to say that hallucination is caused by Satan is Surah An-Nas lah kan. Alladhi yuwaswisu fi sudurin nas minal jinnati wan nas. The whispering which is whispered by Satan and mankind. So what is the definition of this whispering? Whether it's actually talking about hallucination, or it's actually about hearing real things outside there, or it's actually insinuation of negative thoughts in our mind. Because if you say hallucination, how much of our population experience hallucination? And Quran is book for everyone, so it must be able to explain the experience that we all experience. So probably, wallahu alam, it's about the negative thoughts, the negative ideas that Satan inserted in our mind. Kan Imam Al-Ghazali, orang-orang macam Ibn Qayyim semua ni, they talk about talbisul iblis, bagaimana iblis, you know, how the deception of devil deceptions, how the Satan tried to deviate you from doing the right things. Even though you start with something good, you know, you come to class and then give lecture, but Satan has their ways to deviate you, to think that you are doing the right thing, but actually no. So that is the general meaning, you know, inserting new ideas, bad ideas in your mind. I cannot do justice to the question, so I would suggest I'll give the article for you to read, or maybe if we have more time afterwards in other classes, we can talk about this more. Okay.
Sure. Okay, thank you.
Thank you, Aiman. Okay, thank you, Aiman. Okay, thank you, Nizam. Sorry ambil masa sikit. Kita jumpa lagi insyaAllah. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum. Thank you, Dr.
Nah, apa pula dia leave.
Dia masuk sungai habis kan?
Assalamualaikum. Dah boleh start ke?
Okay, Assalamualaikum. Do you all need a break before we start?
Okay.
Do you want break?
Yes, Doctor.
Okay, alright. So 5 minutes, you go.